Femoral hernia. Now, if we see the first diagram, the femoral hernia, a sac-like structure which is located below the inguinal ligament and medial to the femoral vein. In the second diagram, we could see the parts of the hernia, which is the sac and the neck. In the sac, we can see the sac of hernia along with its coverings and the loop of intestine as its content, and the neck region, which is a constricted part. In this diagram, we could clearly see the course of femoral hernia, that is the course of herniated intestinal loop. First, the hernia passes downwards through the femoral canal, which is a part of femoral sheath. Then, it passes downwards through the saphenous opening and pierces the cribriform fascia, and finally travels upward along with the superficial epigastric and superficial circumflex iliac vessels. Femoral hernia overview. The femoral canal is an area of potential weakness in the abdominal wall through which abdominal content may bulge out, forming a femoral hernia. It can appear as a painful lump in the inner upper part of the thigh or groin region. The lump can be pushed back or it naturally disappears when you lie down. The lump reappears when on coughing or on straining. Causes of femoral hernia. Fatty tissue or a part of bowel pokes through into the groin at the top of inner thigh. It pushes through a weak spot in the abdominal wall into the femoral canal. It is more common in elder women because of the wider shape of the female pelvis and smaller size of the femoral vessel in women. It appears suddenly when straining on toilet due to constipation, on carrying and pushing heavy loads, on chronic cough, on straining to urinate because of enlarged prostate, in obesity patients, and during parturition. Complications of femoral hernia. Obstruction. Loop of bowel may get narrowed in part, so contents of the loop cannot move forward, causing obstruction, but can move backwards. In strangulation, it leads to blockage of arterial supply that cause necrosis of loop. Need for surgery. There are two ways to repair femoral hernia. First is the laparoscopy surgery, where several smaller cuts are made, allowing the surgeon to use various instruments to repair the hernia. Second is the open surgery, in which there is a cut made along the lacunar ligament, which form the medial boundary of the ring of femoral canal, so that the surgeon can push the loop back into your stomach. This figure shows the pubic region seen from behind to show the course of an abnormal obturator artery. A is the femoral canal, B is the femoral vein, C is the junction of external iliac and femoral arteries. X usual safe course of abnormal obturator artery. Y is the occasional dangerous position of the artery. Surgical precaution. The abnormal obturator artery may lie along the medial margin of the femoral ring, that is, along the free margin of lacunar ligament. Such an artery is likely to be cut if an attempt is made to enlarge the femoral ring by cutting the lacunar ligament, leading to alarming hemorrhage. Occasionally dangerous position of the artery, so care must be taken. Sometimes there may be presence of uncommon complications like developing a lump under the wound, difficulty in passing urine, injury or narrowing of femoral vein, injury to bowel, temporary weakness of leg, injury to nerves causing pain or numbness in the groin region. Hernias cannot be cured naturally and it needs medical treatment. We could potentially prevent the femoral hernia by focusing on our strength core, like practicing healthy exercise and avoiding weightlifting, by maintaining our weight, by eating high fiber, high protein, low fat diet, and high water intake.